Hi, I'm Dr. Katelyn Stepan, a head and neck surgeon at Northwestern Medicine and assistant professor at Feinberg School of Medicine. Thank you for joining me today to talk about post-operative pain management and opioid use. Today we're live from the Northwestern Medicine Head and Neck Clinic at the Warrenville Cancer Center. And if you have questions during the talk, feel free to post them to the comments section and I'll get to them at the end. So first, I just want to thank LivingWell for inviting me here to speak with you guys today. I'm going to use the next 10 to 15 minutes to talk about pain management in the post-operative setting. And that means really the few weeks after surgery that a patient's recovering. In my case, I'm primarily dealing with patients undergoing head and neck cancer surgery, but much of what I talk about today will be more generalizable to a number of different types of surgery and post-operative pain management in general. I'll start by giving you an overview of opioids and then go on to discuss some more recent guidelines that we've developed regarding specifically post-operative pain management and opioid use. So to dive right in, as some of you may be familiar with, opioids, also commonly referred to as narcotics, are derived from opium, which is a natural extract from the poppy plant. They're legally available for healthcare providers to prescribe for pain management in a number of different forms. You may have taken or heard of morphine, oxycodone, Norco, Vicodin, Percocet, and they're present in street drugs such as heroin. They were actually originally used by ancient Egyptian civilizations for pain management, specifically during giving birth. They've been used in the U.S. since the 1860s, the time of the Civil War, and they're highly effective painkillers, but do have a very high addictive potential. Unfortunately, opioid addiction, misuse, and overdose-related deaths have been rising, and to such an extent that the U.S., within the U.S., that the Department of Health and Human Services declared the opioid epidemic a public health emergency in 2017. An estimated 70 to 80,000 overdose-related deaths occur every year. These medications are still commonly prescribed for use after surgery. And because of this, more recently, there's been a really large nationwide effort to improve safe prescribing practices among physicians and also to educate patients. There's also been a large effort to explore other non-opioid pain management options. The American Academy of Otolaryngology and Head and Neck Surgery recently developed new guidelines related to post-operative pain management in order to combat some of these concerns, and these came out just last year. And so I'll be reviewing some of those aspects with you today. We'll be focusing on post-operative pain management, but a lot of cancer patients require more long-term pain management for chronic pain. And typically in these cases, we get our pain management specialists involved. So that's a little bit outside of the scope of today's discussion. But to highlight some aspects of the new guidelines, first, before surgery, patients should be counseled on the amount of time and the severity of pain that they're going to experience after surgery. This can help alleviate patient anxiety and can actually also reduce the amount of opioids taken after surgery. So absolutely feel free to speak with your surgeon before any procedure regarding what to expect and what the and review what the pain management plan is. Additionally, if you're already taking opioids, have a history of drug or alcohol addiction, or have a history of depression or anxiety, certainly feel free to mention these to your physician beforehand because you may be at increased risk of opioid abuse. And you and your surgeon can really work together to develop the best pain management strategy for you. Importantly, pain management strategies should be multi-modality, meaning there are multiple aspects to the pain therapy plan. I generally like to think of this in three parts. The first part is pain relief strategies that don't involve medications. So depending on the surgery, this could include things like icing, elevation, resting, or adjunct methods such as meditation and acupuncture. The second aspect is non-opioid pain medications. These should really be the first-line therapy for post-operative pain management. Simultaneous use of multiple non-opioid pain medications can really have a synergistic effect and ultimately decrease the use of opioids, decrease the opioid-related side effects, and improve overall pain management. So the typical non-opioid pain medications we think of are Tylenol and Nsaids, or non-steroidal anti-inflammatory drugs. Nsaids help reduce swelling and also help control pain. Tylenol helps control pain and can be taken in conjunction with Nsaids. You can take higher doses of Tylenol in the postoperative period. You shouldn't exceed 4,000 milligrams a day. It's very important to keep in mind that some opioids are prescribed with Tylenol in them, so you need to be aware of this and make sure you calculate that into your daily dose. Oftentimes, these two medications, Tylenol and an NSAID examples are ibuprofen, Advil, Aleve. These can be taken together, oftentimes in a scheduled fashion. For instance, meaning every 6 hours around the clock, whether or not you're in significant pain at that time. What this does is kind of help stay on top of the pain and helps give you better overall pain control in many instances. Nowadays, there are other non-opioid medications that we're tending to use more and more. In head and neck cancer, we use a medication called Gabapentin a lot, and I've seen a lot of success in many of my patients in terms of managing pain with this. You can use it before, during, and after surgery, and can use it for longer periods of time. It's particularly helpful with controlling nerve pain. When using multiple different medications for pain relief, they can actually work on different receptors and end up giving you better overall pain control. And so the third aspect of this multi-modality plan is opioids. As I mentioned, as first line, we use a combination of non-opioid medications such as Tylenol, Nsaids, and Gabapentin. And if pain is not adequately controlled with those, we can then add on opioids to this regimen. Opioids should be taken on an as-needed basis and at the lowest dose and for the shortest amount of time possible. Additionally, opioids can be associated with a number of side effects, constipation being one of the main side effects. Make sure you're drinking plenty of water, taking a stool softener, and staying mobile. Nausea can be associated with opioid use. Definitely try to eat before you take any opioid medications to help alleviate that. Patients can also experience lightheadedness, dizziness, headaches, sedation, and hallucinations. If you experience hallucinations, stop taking the medications immediately, and certainly communicate with your physician if you're not having adequate pain control or if you're experiencing any significant side effects. In all, it's really important for the patient to understand the risks and benefits of these medications so that they can really partake in shared decision-making with their physician to find the best therapy plan for their specific needs. Lastly, I just want to highlight some important points on how these medications should be stored and discarded. Many patients have leftover opioids after surgery, and the most common source of misused prescription pain medications is from a family or friend. That's why it's so important to store and dispose these medications responsibly. The best disposal option is to find a drug take-back location. These are present at many pharmacies, or at various law enforcement facilities. You're able to even Google drug take-back locations near you. If you don't have a drug take-back location nearby, the next best option, if the medication is on the FDA-approved flush list, is actually to flush the medications down the toilet. Most commonly prescribed opioids are on that FDA-approved flush list, so that's also a viable option. I would just make sure to check that list beforehand. The reason for disposing of these medications in this way is to prevent both children and adults from either accidentally or intentionally ingesting, misusing, or abusing these medications, which can result in serious consequences. Additionally, of course, you should never share your prescription pain medications with family or friends. So just to review and highlight some of the main points just made. First, opioids are highly effective but can be highly addictive painkillers. The rates of opioid abuse and overdose are high nationwide, and that's led us to the development of these new, more recent guidelines, particularly regarding post-operative pain management. These guidelines include recommendations for multi-modality pain management strategy, with the first-line therapy being a combination of non-opioid medications such as Tylenol, Motrin, and Gabapentin. Opioids can be used on top of these medications on an as-needed basis if pain isn't otherwise controlled, but should be used at the lowest effective dose for the shortest period of time. Opioids should be safely stored and discarded, either returned to a disposal facility or flushed if on the FDA-approved list. And open communication with your physician regarding the pain management strategy before and after surgery is strongly encouraged to help control your pain in a safe and effective way. With that, I'm happy to take any questions that you might have.
I have two ones that have come in earlier that I'll give people time here, but one question is, should I have Narcan in my home in case of an accidental overdose?
Sure. That's a great question. Narcan is a medication that's used in the event of an opioid overdose. If opioids are taken in the amount and at the frequency as prescribed by your physician for post-operative pain management, you should not, typically be at risk for an overdose. So we do not routinely recommend that patients have Narcan available. However, if you are on more chronic pain medication or on higher doses for some other reason, your physician may recommend that you have Narcan available, so certainly a discussion to have with them. In any event, if an overdose does occur, of course, the first step is to call 911 and administer Narcan if available.
Another question, is medical marijuana a viable option for pain relief after surgery?
Sure. So in some instances, medical marijuana may be a viable pain relief option, particularly when we're talking about chronic cancer-related pain. There are only certain providers who have the expertise, experience, and training to prescribe these types of treatments. So perhaps your physician can help you get connected with someone that has those capabilities.
Do not see any questions that have come in yet. Let's give it like a second here.
Sure.
It is a quiet group today. It's probably because your presentation was so thorough. It looks like there are no questions at this time. No further questions.
Okay, great. Well, thank you guys so much for joining me today. Please be sure to follow LivingWell's Facebook page for upcoming Facebook Live medical discussions on cancer-related topics. Thank you.